Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. Ten minutes past 8 o'clock. It is Wednesday morning, the 10th day of December, 2025. Good morning, everyone. I'm Scott Michlin. Thank you for tuning in to KSJE 90.9 FM over the airwaves here in San Juan County, New Mexico. In Durango, Colorado, our radio signal is on 103.3 FM. And if you're listening to my voice anywhere else on planet Earth, you've gone to our website to tune in, ksje.com, or maybe you're listening to my voice through the new KSJE radio app. It is great to have you all with us this morning, everybody. Also, welcome to our viewers who are watching the program, the video of this program, streaming out live to the KSJE Facebook page and also to our YouTube channel. So glad that you're all with us this morning, because coming up, our guest from San Juan Regional Medical Center, we are getting an update on the new residency program here at San Juan Regional Medical Center. We'll explain more about what that means to our hospital, our community, and much, much more coming up in the next few moments right here on KSJE. Then, of course, we remind you, next hour, Mick Hess will take us roving with the arts. That is our weekday classical music program. That is coming up at 9:06 on KSJE today. Take us to 10:30, and right on Four Corners, our local and regional author program. This week, Delcherie Gladden is talking with Bloomfield author, that is Matthew Alexander. He's her guest today at 10:30 on KSJE. Don't forget, you can also connect with us on other forms of social media in addition to Facebook and YouTube. How about Instagram or Blue Sky or X? And if you listen to podcasts, you can find our podcasts wherever you listen to them. They're available. Subscribe for free and maybe discover a new local program that you may have missed recently, or get ready for those holiday road trips and listen to something local. The new KSJE radio app is also available. It is available at the App Store and Google Play. You can connect with our podcast there as well. You can listen live and much, much more. Take us with you on the go. It's the new KSJE radio app that's available now. Outside our studios at San Juan College this morning, right now, it's sunny and 29 degrees. We are expecting lots of sunshine today. Temperatures reaching about 49 degrees this afternoon. Clear skies overnight with a low of 29. Sunny and 50 degrees tomorrow, back down to 49 on Friday, 48 degrees for a high on Saturday. Overnight lows, as you can see, still mostly hovering right around upper 20s, 30 degrees or so. I'll be back with my guest from San Juan Regional Medical Center right after this on KSJE. KSJE is supported by San Juan Regional Medical Center. The caregivers of San Juan Regional Medical Center are committed to bettering the quality of life, health, and care of individuals, families, and our communities. Life is their sacred trust. Better is their mission. Here is their home. San Juan Regional Medical Center, improving the health of the Four Corners since 1910. I'm back in Studio A this morning with my guest, as I mentioned, from San Juan Regional Medical Center, friend of the show. It's always great to have her on. Back with us this morning, Dr. Erin Philpott is joining us this morning. Dr. Philpott, welcome back to KSJE. Good morning.
Good morning, Scott. It's great to be here. Thank you for having me.
You bet. Thank you for taking the time to visit with us about this exciting residency program at San Juan Regional Medical Center. We talked to Dr. Underwood about that a few months ago, as it was just kind of coming into development stages, and now I understand there's a lot more to share. So can you give us an update on how things are going?
Yes, indeed. So some very exciting news. We were accredited by the Accreditation Council of Graduate Medical Education, which is essentially the governing body here in the United States that evaluates programs, hospitals, and all the provided content for accreditation or approval, ensuring their standardization across medical training. So we received our accreditation in September, and we are now recruiting, accepting applications for our first class of internal medicine residents. We've had many, many applicants, over 1,000 in fact.
Wow.
And we intend to start, just 4 residents, July 1st, this next year, July 1st, 2026. So we are busily preparing for the arrival of residents and currently interviewing many individuals, about 76 interviews we're doing over the course of November, December, and January.
Got you. And these applicants that you've been looking at, these 1,000 applications, are they from the state, the region, or all over the place? Where are they coming from?
Yeah, great question. So actually all over the world.
Wow.
We do have some applicants from the United States, but the vast majority of our applicants are international medical graduates. This is fairly common, especially for new programs, but overall in the United States, about 40 to 45% of internal medicine trainees are international medical graduates and then compose a large portion of our actual physician workforce here in the U.S.
Got it. And so help us understand maybe how the residency kind of works into someone's education or future doctor's education, right? They need a residency kind of to move on to the next level. Is that an important step, I guess, in getting to practice medicine?
Yes, excellent question. So just to walk you through kind of the whole training journey, I
Right.
guess you could call it, to become a physician, which is quite long and indeed a journey. So of course, first you attend and this is the United States, of course. Other countries have a little bit different structure, but somewhat equivalent. So in the United States, you attend your undergraduate medical education for 4 years. You can major in anything, but you are required to complete certain pre-medical classes. You take the MCAT, which is like the medical school entrance exam. You then go to medical school for 4 years. The first 2 years are traditionally more like classroom teaching experiences like anatomy, physiology, pharmacology, all those sort of core foundational concepts. The second 2 years are traditionally your clinical years, so you're doing rotations, and the community is likely aware we have medical students primarily from Burrell College of Osteopathic Medical School, but from other places as well, rotating already at San Juan. So those are medical students in their third and fourth year of medical school. Once you complete medical school, then you go on to apply for the specialty of your interest. So we have internal medicine, of course, which is then the launching point to multiple other subspecialties like cardiology, rheumatology, endocrinology. Internal medicine residency is 3 years in duration, and as I said, there's a very structured curriculum that the ACGME, or Accreditation of Graduate Medical Education, requires. And then after completion of your residency, you become a full-fledged doctor. So internal medicine physicians can go on to become either physicians who work in the hospital, like I do, or primary care physicians that work in the community and manage primary care needs, or on to fellowship, which is, as I was mentioning, where you can become a subspecialist, like a cardiologist, nephrologist, etc.
Got you. But that residency, I guess, is the key to opening up those other journeys, as you would say.
Definitely, yes.
Got it. And so with this, is it the hope of the program and the hospital to maybe get some of these residents here, and then maybe they enjoy their time so much they don't want to leave after 3 years and maybe set up shop either in the community or fill an opening at the hospital or some local need?
Yes, that is exactly the goal. So evidence shows that about 60% of graduates from residency programs who do school and their residency in the area, they stay and practice in the area where they complete their training. So there's pretty good evidence to suggest that that is what happens, and that is our goal. And in fact, that was a big reason why we as a hospital have pursued graduate medical education here at our facility, because we do have a very significant shortage in San Juan County of primary care physicians, specifically internal medicine primary care physicians. And then, of course, we have a void of subspecialists as well, and hospital medicine physicians as well.
Got you. And you said the first class is going to be made up of how many of these residency students?
So our first class will be 4 residents, and however, we do intend to build our program over time with an ultimate goal of 24 total, or 8 residents per class.
Got you. And that's where I was going with that, to wonder if it was planning to grow and to involve more future doctors here as the program gets underway. But with this first one, it's very exciting to start off in July, I think you said, with these new graduates, basically, to form a residency here at the hospital. What have you heard from some of your colleagues there at the hospital? Are they excited to kind of rub elbows with these freshly minted medical students and show them the ropes, as it were, at the hospital?
Yes, I would say there's great excitement in welcoming these residents. I think residents add a lot to a culture. They're, of course, these young doctors just coming out of medical school with fresh knowledge and a fresh perspective, and kind of looking at things through a different lens. So I think generally the feeling here among the staff is one of excitement. And I think the community should also feel that way. There's some pretty good evidence to suggest that quality of care actually improves with the presence of graduate medical education programs and learners in hospitals. And even mortality rates have been shown to go down, readmission rates. So there's a lot of meaningful metrics that are impacted by the presence of learners. And it's probably for a lot of reasons, just having, a whole team of doctors thinking about each individual case, additional interaction time with patients, quality improvement initiatives that residents do, research that are typically led by attending physicians, but residents certainly hugely contribute to. So I think there's a lot of excitement all around.
Very good. And Dr. Philpott, are you getting any flashbacks back to your residency and your time kind of learning a little bit as you started your medical career?
100%. Yes. It's making me think about it a lot, and what was hard and what I liked. And, I think the different, of course, generations coming into the workforce have really different values and outlooks. And so I think there's some real benefit to that, and I anticipate some real challenge there too. We did, 30-hour call shifts when I was completing my residency, and that is not so popular anymore for quite obvious reasons. So it's going to be a big shift from even when I completed my training to now. And I think it's been really incredible to be here from kind of the inception of the program, and, creating those building blocks to create this structure of graduate medical education, because I think there is great opportunity for innovation and creativity in how we educate our physicians, our future physicians coming into the workforce in a really positive way to provide excellent care.
And can you remind us where you served your residency?
Yes, I went to University of Washington, so it was a very large academic center, and I trained at the county hospital there, Harborview, it's called, in downtown Seattle, as well as University of Washington Medical Center and the VA there in Seattle as well. So diversity of hospital environments, but quite different compared to like a community training program.
Right, which will be offered here, I guess, right, with San Juan.
Exactly, yes.
And is that something that maybe some of the applicants are pointing out that they're interested in, is maybe working at a smaller facility and not a big city metropolitan type of hospital, and maybe working at a community hospital like San Juan Regional and learning the ins and outs, because certainly the type of care can be somewhat different, and the type of patients that are coming in from far distances is quite different than maybe being in a metropolitan area?
Definitely. Yeah, we've had a lot of applicants specifically express their desire to train in this region. The community operated and owned hospital environment, I think, offers really a lot in that regard. You're a true individual in our system, I think, as compared to, not that I didn't feel that way in residency, but when you're in this lumbering beast of an academic institution, you are not so much seen as, an individual. So I think there really is the desire specifically to come here, and really just incredible stories from these applicants, Scott. I mean, from all over the world. We have a large number of Pakistani applicants, applicants from India, Nepal, and just remarkable stories of resilience and perseverance, and really smart people, and wanting to serve the underserved. So true service and dedication to their profession. So yeah, they have sought out our area very specifically for their training.
Very good. And I want you to give some credit to some of the other folks I know who are working on this with you. You're not doing it all on your own. There's probably a team of folks there. As we mentioned, Dr. Underwood has been part of this too, that put this residency program together and gone through the accreditation process, and to make sure all the T's are crossed and I's are dotted to get this thing as a go in July.
Yes, absolutely. It is definitely a team effort here. Kind of all hands on deck at this point. There's no department at our hospital that I think is going to be not impacted. The way GME or graduate medical education works in finance and billing, it is a widespread impact, and certainly Dr. Underwood's leadership has been invaluable in getting this program up and going. And I will say Desiree Kenneth, who is our program manager, program coordinator, who has worked here at San Juan Regional and patient experience, and then transitioned into this role just over a year ago now. She has been exceptional, an extremely organized individual, hardworking, and just learning the ropes of the whole process. So definitely a team effort here, and but I think everyone's really excited about it. We're doing new things. We have a medical education building now. We're building a simulation lab. The foundation has generously donated to that effort, and really getting all the pieces in place to create a really rich learning environment for these new physicians.
Very good. Well, congrats to everyone who's been involved in this effort, because I know, again, it seems to me like a game changer to be able to kind of grow your own, as it were, to try to train and offer residency to some physicians, future physicians, and then hopefully have many of them stay and set up practice in the community. And can you tell, and I don't know if you know the answer to this question, Dr. Philpott, but I bet you do, because you're pretty smart. Do you know how many hospitals the size of San Juan Regional have a residency program? I would think it's somewhat unique to a hospital the size of our local community hospital.
Yeah, that's a good question, and I don't know the answer to that, Scott, quantitatively. I will say there's a pretty good number of community programs. In fact, I went to a conference recently, a month ago, about in Atlanta, where we met with, it was all the program directors across the country. So there was a great number of community hospitals represented there. I think there's been, of course, with just healthcare shortages in every discipline across the United States, a great effort around the country to increase available resident physicians to get through their training to become physicians. So that number has been growing every year. Additional programs accredited, but I don't know exactly how many.
Okay, I didn't mean to put you on the spot, but thank you for answering the question. And but it is exciting, as I mentioned. I think this is kind of a long-term goal as well, to increase the physicians in the community. And so I think the idea behind this is that kind of a long-term investment, right? Even though we're going to have these 4 new residents in July, and you mentioned growing the program, that eventually the idea is to have 20 plus folks in this program, and to be able to keep adding more to the local inventory, I guess, of doctors in the community?
Yes, that is the long-term goal. So our program specifically is we are, the structure is a bit complicated, but in essence, we are being sponsored is the word, sponsoring institution by the
Right.
New Mexico Primary Care Training Consortium. And they're a consortium that is, their goal is to increase, as I was just saying, the training possibilities for specifically primary care physicians. So our community needs assessment a few years back identified that we have a significant shortage of specifically internal medicine primary care physicians. And internal medicine physicians and primary care are trained particularly to deal with medically complex patients with multiple chronic disease conditions and kind of integrate all those pieces and provide a holistic plan for management of care. And I think we all know we have a very medically complex patient population here. But back to our community needs assessment, we identified that by 2026, our community would need about over 60 FTEs, so full-time equivalents of internal medicine primary care physicians. And we currently, to my knowledge, have about 5 FTEs in our community working as board-certified internal medicine primary care physicians. So our goal truly, as I was mentioning, any career path could be sought coming out of our program in internal medicine. So that subspecialty opportunity, hospital medicine opportunity, or primary care. But we are designing our program specifically, hopefully, in a way that really inspires that primary care pursuit. Because it is so important and it is exactly what our community needs. And we are hopeful that those individuals will want to stay and practice within the community they trained and serve those community members.
Right. And so a lot of thought went into, I guess, how you set up this residency program to fill this, I guess, most immediate need in the community based on that needs assessment. And I guess my next question would be, is it somewhat easier then once this residency program is up and running to kind of shift focus or add to it, to add another maybe specialty besides internal medicine to a residency program, or would you have to start all over from scratch, as it were?
Yeah, so and you're asking about can we add additional subspecialty programs?
Right.
Once it's
up and running.
Yes. So that is something that we have talked about and considered, but don't have a definitive plan on. It's the federal government and the reimbursement and the finances of graduate medical education is quite complex. But the bottom line is we will need to add additional programs if desired within 5 years of starting our program. So we are, it sounds like a long time, but gosh, that happens quickly and there's a lot of pieces to get in place before doing that. But we have considered adding additional subspecialty opportunities after we get kind of settled in and get this program up and running, which I think would be, just continued benefit to our community, our hospital, our entire catchment area.
Sure, got it. But certainly you're meeting the initial needs and maybe the greatest needs with this internal medicine track, which is really exciting to hear about. And so, Dr. Philpott, between now and July, I guess the idea is just to kind of identify the first class of your residents and get them orientated to starting to serve in Farmington in the summer, I guess?
Yes, so there's actually an incredible amount we need to do before July 1st, but that is one of the things. As we complete interviews, the way the medical system works is after there's a centralized application service that I mentioned, and then we as the program will identify our applicants in order of rank that we desire to have at our program. All the applicants will do similarly. And then in March, it's called The Match. There's a match week over generally the week of St. Patrick's Day. and we find out who is this massive statistical machine that matches programs with residents. And we find out who we match to our program. Of course, the residents find out, or the applicants find out, what residency they match to. And then we will hit the ground running. We will likely need to get some visas. As you are likely well aware, the visa environment has been very interesting over the course of the past year. So that adds an element of complexity to things. And then we will get them, they will be starting orientation July 1st. So we're building curriculum, we're arranging rotations, we're adding software to our organization, we're building our simulation lab, we're working with faculty and doing trainings. So a lot of different activities to take place before then. But I feel confident we're going to get it done, and we're going to get it up and running and off on the right foot right away to best support our residents.
Well, I do too. It's very exciting news, and I know if you all down at San Juan Regional Medical Center have a goal, you always reach that goal, so I wouldn't be surprised if that happens maybe a little bit ahead of schedule, but I wish you good luck with it. Real quick before we run out of time, Dr. Philpott, you mentioned the support from the San Juan Medical Foundation. I just want to put a shout out to them. They do so much in our community, and it sounds like they have helped with this residency program as well.
Yes, yeah, they've been incredible. We put in a request to the foundation for the building of a simulation lab, as I was mentioning. So we're getting a high fidelity mannequin, which we'll be doing multidisciplinary trainings with, and a number of other different procedural equipment items, as well as some consultation from a consultant at Brigham and Women's at Harvard. So yes, so grateful for them, Scott, and just the whole community, really, and standing up and the support and surrounding institutions to help make this happen. And not only make it happen, but make it a incredible program, or what I envision to be an incredible program that will really give back to our community in many different ways.
Very exciting. Well, Dr. Philpott, we're so excited to hear the update and to know that this is happening. It seems like it wasn't too long ago I was talking to Dr. Underwood about this kind of thought and idea, and now it's coming to fruition. So it's very exciting to see this happening in the community and knowing what a difference it will make for patients and folks who are needing primary medical care in the community. So thank you again for your time. You're always so generous, and it's always great to see you and visit with you. Thank you very much.
You too, Scott. Thanks so much. Really appreciate it.
Of course. Thank you very much. That's Dr. Erin Philpott, San Juan Regional Medical Center, talking with me about the new residency program here in San Juan County. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.